And now taking a look at some news on the national front, AP News is reporting that around 49,500 people took their own lives last year in the United States, the highest number ever. The CDC, which posted those numbers, has not calculated a suicide rate for this year, but available data suggests suicides are more common in the States than at any other time since the dawn of World War II. Experts caution that suicide is complicated and the recent increases might be driven by a range of factors. Now, that includes higher rates of depression and the limited availability of mental health services. But according to Jill Harkavy-Friedman of the American Foundation for Suicide Prevention, the main driver is the growing availability of guns. Suicide attempts involving guns end in death far more often than those by other means, and gun sales have boomed, placing firearms in more and more homes. A recent Johns Hopkins University analysis used preliminary 2022 data to calculate that the nation's overall gun suicide rate rose last year to an all-time high. Suicides in the United States steadily rose from the early 2000s until 2018, when the suicide rate hit its highest level since 1941. That year saw around 48,300 suicide deaths. Now, the rate fell slightly in 2019, and it dropped again in 2020 during the first year of the COVID-19 pandemic. But then in 2021, suicides rose by 4%. Last year, according to new data, the number jumped by more than 1,000 to 49,449, which is about a 3% increase versus the year before. The largest increases were seen in older adults. Death rose nearly 7% in people ages 45 to 64, and more than 8% in people 65 and older. Despite the grim statistics, some people say that there's reason for some optimism. Now, a national crisis line launched a year ago, and it's available to those needing help. Anyone in the United States can dial 988 in order to reach mental health specialists. Again, that number is 988.